Acute kidney injury, also known as AKI, is one of the most significant and potentially deadly diseases you've never heard of. Up to 50% of patients in the ICU will develop some stage of acute kidney injury. Short and long-term consequences could be more than twice as severe, such as hospital length of stay, hospital cost, 30-day readmissions, and hospital mortality.
The challenge is that acute kidney injury is difficult to identify early. For the last 60 years, the diagnostic paradigm relies largely on biomarkers of function known to be insensitive and slow to change, often leading to a late and inaccurate diagnosis with adverse outcomes. Identifying those at risk is paramount, as early knowledge may prompt closer patient monitoring and help prevent kidney damage or death.
The NEPHROCHECK test from Acute Medical is a commercially available, first-of-a-kind test to assess the risk of acute kidney injury. This test measures biomarkers of cellular stress in the early phase of tubular cell injury. In 20 minutes, the test quantitatively measures two urinary biomarkers, TIMP2 and IGF-BP7, and combines them into a single AKI risk score. The NEPHROCHECK test cutoff of greater than 0.3 has been established based on results of rigorous clinical studies to achieve high sensitivity while preserving acceptable specificity in order to identify the majority of patients at risk of developing acute kidney injury. The NEPHROCHECK test allows the clinician, along with their clinical judgment, to identify patients at risk of developing moderate to severe acute kidney injury within the next 12 hours. The test was rigorously validated in 2 multi-center studies in over 500 patients with diverse reasons for ICU admission, and patients had common comorbidities.
The NEPHROCHECK test allows clinicians to identify, stratify, and mitigate a patient's risk of acute kidney injury. Patients who are at risk benefit from early identification when the knowledge may prompt closer patient monitoring and help prevent kidney damage or death. With dynamic measurement of the risk for AKI, there will be the opportunity to initiate timely and appropriate preventative therapies and monitoring in the intensive care unit for those patients who are judged to be at high risk of AKI.
As well, less costly interventions are easy and reasonable to implement if risk is identified, such as avoiding nephrotoxic drugs, contrast media, and avoiding anesthetic techniques that may contribute to hemodynamic instability in high-risk patients.
Recent published literature has discussed the role of the NEPHROCHECK test used in conjunction with clinical judgment and includes recommendations on preferred kidney-sparing strategies to help prevent kidney damage.
With early identification of patients at risk, there is an opportunity for management strategies that may attenuate AKI severity, thereby impacting morbidity, mortality, length of stay, and cost associated with moderate to severe AKI.
The NEPHROCHECK test is the first commercially available test in the U.S. that allows for early AKI risk assessment in ICU patients and is the first significant innovation in AKI risk assessment in decades.